I'm Dr. Danielle Worthington from the Laboratory for the Treatment of Suicide-Related Ideation and Behavior at Uniformed Services University of the Health Sciences in Bethesda, Maryland. Members of the military have historically been at lower risk for suicide than members of the general public. However, in recent years, the rates of suicide have increased for service members and veterans. When someone is experiencing emotional pain and distress for whatever reason, and feel like they are a burden on others or that they don't belong or fit into the community around them, they might experience thoughts of suicide or a wish to go to sleep and not wake up. One treatment for someone experiencing a suicidal crisis is cognitive behavioral therapy. Cognitive behavioral therapy focused on addressing self-harm can happen in 3 general phases. During the first phase, the therapist works with the service member or veteran to listen and understand their unique story and help identify the thoughts, feelings, and behaviors that are connected to their desire to harm themselves. Another piece of this stage involves building a safety plan that can be used in a crisis. During the second phase, the therapist and veteran work together to create a toolkit that can be used to manage difficult emotions, reduce feelings of loneliness and isolation, and increase hope for the future. They will also work during this stage to change thinking patterns that are causing problems or just aren't working for the veteran. This skill building phase is specifically tailored to the individual so that it can be the most effective for them. During the third phase, the focus is on preventing another suicidal crisis. The therapist and the veteran will work together to consider challenging situations which might be difficult to manage. We can think of this stage as a sort of fire drill. We hope that our house doesn't catch on fire, but on the chance that it does, it's important to have a plan in place ahead of time so that we can act quickly when the crisis happens. If you or someone you know is experiencing thoughts of suicide, the first step is to reach out for help. There are a number of resources available to service members and veterans, including the National Suicide Prevention Hotline at 1-800-273-8255. You can select option 1 if you want the military-specific option. And know that if you're feeling like suicide is your only option, you're not alone, and we're here to help.